Hi, for today, we will be talking about case analysis. This is the case of a 12-year-old male moderately obese with complaints of vague pain in the right hip and thigh that radiates to the knee, has pain during ambulation, has limitation of arm on the right hip flexion, abduction and IR, and able to tolerate weight bearing but with less than 125 neck shaft angle. So first, let's know what condition produces the patient's symptoms. The condition that produces the symptoms of the patient is slip capital femoral epiphysis. This condition is commonly observed in children 10 to 16 years old, more common in boys than girls, occurs predominantly in obese children with underdeveloped sexual characteristics, has history of rapid skeletal growth immediately preceding displacement of the epiphysis. This injury is sustained in the femoral head wherein the head of the femur slips downward and backward on the neck of the femur. The contributing factor of this condition is the child being moderately obese because it places more shear forces around the proximal growth plate in the hip. For the clinical manifestations, there is a shorter and smaller affected limb, limitation of motion on the IR and abduction, and during a flexed affected hip, it tends to abduct and rotate externally and has a referred pain on the knee and anterior hip when limits of ROM is reached. To confirm the diagnosis, X-ray is the primary imaging to be used. During early slippage, lateral view must be obtained since the first displacement happens posteriorly. When further slipping has taken place, the anterior-posterior view may show a displacement of the neck upward and forward on the head of the femur. In chronic displacement, a new bone will fill the gap created by the displacement of the head and will result to a coxa vara or decreased neck shaft angle. These three imaging are not routinely performed but are helpful to confirm the diagnosis and measure the degree of displacement. It is also important to determine if the lesion is stable or unstable, and these are the characteristics of mild or stable SCFE. In more stable or severe SCFE, these are the characteristics of the patient. The history that are important to be documented in this condition are HPI, PMH, and HFD to note the chronicity and since genetics and metabolic endocrine disorders may also be associated.